What is Ring Chromosome 20 syndrome?
Ring Chromosome 20 syndrome is a rare disorder characterized by drug-resistant epilepsy and mild to severe cognitive impairment. The occurrence of seizure is often the first sign of the disease, and this is also the sign that often brings the child to medical attention. Epilepsy in Ring 20 syndrome is characterized by different seizure types, often with an age-dependent course. Nocturnal focal seizures with motor signs associated with terrific hallucinations can be the presenting seizure type. Afterwards, focal seizures with automatism and non-convulsive status epilepticus appear.
Why is this condition difficult to diagnose?
Children with Ring 20 syndrome do not show dysmorphic features, and they usually have a regular development before seizure onset. But after the beginning of seizures, which often become drug resistant, they can have a cognitive decline and a behavioral disorder that can be considered an epileptic encephalopathy. The gold standard of the diagnosis is a karyotype, but it is often delayed and not routinely performed. Therefore, the Ring 20 syndrome is presumably an underdiagnosed condition. EEG can be often considered normal in many patients, but it is possible to recognize a typical pattern characterized by trains of theta-delta waves that can address the clinician to ask for cytogenetic analysis and to point out the diagnosis itself.
Once it is diagnosed, what can we do to stop the cognitive decline?
It is very important to control seizures and non-convulsive status. We recently demonstrated that stopping ictal EEG activity and controlling seizures may bring to the reacquisition of previous skills and may lead to better outcome in these children.
What about the neuroimaging findings? Does the brain show any abnormalities at the MRI?
Even though cerebral MRI routinely performed is usually normal in these patients, functional neuroimaging studies have demonstrated an involvement in cortical and subcortical structures in these patients. The hypothesis of an involvement in the seizure control system has been evaluated by PET and SPECT studies, and a decrease in L-DOPA uptake in the putamen and in the caudate in these patients compared to healthy controls has been demonstrated. With SPECT study, we demonstrated a dopaminergic dysfunction in patients with Ring 20 chromosome syndrome. Moreover, in collaboration with the University of Modena and Dr. Melletti, we recently performed a GFMRI study in patients with Ring 20 chromosome syndrome, and we show an involvement in multiple structures in the brain, in the cortex, the frontal and the parietal cortexes were involved, as well as subcortical structures, the basal ganglia. So the disruption of this complex network represent a kind of common signature in different epileptic encephalopathies characterized by regression of acquired skills in children.
What are your next research and clinical projects?
We are going to perform new studies using EEG fMRI because the recent studies were performed on a relatively small number of patients due to the rarity of the syndrome. Moreover, we are going to build a dedicated database which will collect information about the clinical history, the EEGs, the MRI data, and also the genetic data of patients with Ring 20 syndrome, not only in Italy but also in different countries. So our project is to share knowledge about the Ring 20 syndrome